want to thank Sinn Féin and I support the motion. But you know, I really wish I was here, having been elected in 16, with a motion from the government and an update on Sláinte care and an update on the primary care strategy, so that we could all participate, because we've been through this song and dance, haven't we, at every single election: public health, public housing, public transport, and deal with the climate change, and we want to pay taxes. That's the message. And so we came together and the report was produced across parties, Sláinte care, showing the way forward. I know that you're doing your best. I've seen it on the ground, and I pay tribute to some of the changes that have come in. However, we're left going from crisis to crisis. I had cause to be in the accident and emergency last week, not for myself, somebody close to me. I was lucky on that day, there were 9. 1 week later in Galway, there are 46 on trolleys. Staff working full time. What is the problem? Complete under-resourcing for donkey's years, a commitment to private medicine, a diversion of our public money into private medicine, and a national treatment purchase fund that's looking at waiting lists that have been deliberately built up. I spent 10 years of my life on a health forum. I saw all the excuses. You're inheriting a system, but you're also part of that system that has refused to say public health, like public housing, public health. And what's needed then? Of course, many things are needed. More doctors, more nurses, proper conditions. I'm in a city where the nursing home in Carrow hasn't put back day. I know both of the female ministers here are deeply committed to this. No day centre in Carrow, no staff. St Clifton's District Hospital closed during Christmas. No hospital to take the pressure off the hospital. I could name them out. Go to Loughrea. They've moved a fantastic day centre. We know that from Councillor O'Donoghue, the independent councillor, moved it into a hotel. The daftest decisions been made. Where does the rollout of primary care? In Connemara, a woman in her 90s had to go into Galway for blood tests because they didn't do blood tests on a Friday. The ECG machine had broken down, so somebody else had to go in for that. Constant pressure. In my own case, with somebody close to me, we avoided an accident and emergency like the plague. To the cost of the patient, should have been an accident and emergency on Wednesday. We avoided it till Friday. We're making decisions that are detrimental to our health. We're not rushing up to accident and emergency. So what we need really from the government is an absolute progress report practically every month on the rollout of Sláinte care, on the rollout, I'll stop in mid-sentence, for